Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us once again for our weekly press conference on Delaware's response to COVID-19. I'm joined once again by the leader of our public health team, Dr. Carol Route, the director of the Division of Public Health. Our emergency management expert and lead, AJ Shaw, is with us again to talk about testing and vaccination. Thank you both for the tremendous work that you're doing with your teams, testing and vaccinating tens of thousands of Delawareans on a weekly basis. We also have Pam, who's our sign language expert for the deaf and hard of hearing. Pam, thanks for joining us again. We have considerable good news to report today. We also have some changes in our approach to vaccination. I think that will respond both to the President of the United States challenge for all of us to vaccinate our educators and teachers, as well as to open up by May 1st registration for vaccinations to all citizens of our state. We're moving in that direction anyway. We've seen really good positive health conditions and data on the ground. We'll talk about those. First off, we're getting healthier. We're contemplating changes to the restrictions for indoor and outdoor gatherings. We've been in conversations, our team and myself, with the mayors this morning, with the White House Task Force later in the morning, with our restaurant leaders and owners, with chambers of commerce, trying to get everybody on the same page as we get healthier here, as we approach spring, and we're healthier and we're moving outside and prepared to react to that. We're getting more people vaccinated, which is a good thing for everybody. So let's move to the data dashboard first. You can see that we're hovering around 200 new cases per day on a 7-day moving average. We moved below it for a few days, and we'd like to keep it headed south and get to below 100 as we were in the summer last year. The percent of the tests that we're doing are positive, under 5% at 3.7%, which is a good number. We still have a little bit of a slacking off in testing, although we're testing at a rate far exceeding what we expected back in the beginning. Again, to AJ and his team and all our partners there, great work. Hospitalizations have dipped below 100, down as low as 95. They're up a little bit here as of yesterday at 106, and nothing that I think indicates any kind of a trend, but we'll keep our eye on that. Everything that we hear in our conference calls with the hospital leaders is that the conditions in the hospitals are looking good. The testing totals you can see here, almost 1.5 million total tests, obviously representing 643, almost 644,000 individual Delawareans who've been tested, and obviously so many people being tested more than once. Our current hospitalizations, which really is a good graph to show the spread and the peaking of the virus back in late April, early May. The early peak then as conditions improved, or early summer through the summer months, and then ticking up after Thanksgiving into December, the December holidays after the new year. We peaked with hospitalizations almost 500 at 474. And at that level, the reports that we got from our hospital leaders was that the conditions in their hospitals were still strong. They had been moving and managing their hospital census and the population there. We never were really in any trouble of not having space for those that had to be hospitalized. So let's look at our vaccination update. We've vaccinated almost 332,000 doses that have been administered. If you add the next two numbers, the doses delivered both directly to the state and to our pharmacy program, you can see over 400,000 doses delivered here. And then we have about 78,000 doses that are in flux in transit. A good portion of those are doses that have been farmed out to our pharmacies and are waiting delivery there at the pharmacies. Some of that is reporting delay. And so our weekly throughput now is about 50,000, AJ, and he'll talk about those venues a little bit later. So we know that the vaccination, the supply is increasing. We know that we will get an increased number of Johnson & Johnson vaccine in early April, and that allotment will be considerably more than what we've been getting, and it will stay at that level for the weeks after that. That was the word from the White House Task Force, from Jess Science, the special assistant to the president this morning. And so we need to be prepared ourselves to move those vaccines into people's arms. We've made tremendous progress getting vaccines out. 20% of all Delawareans have received at least one shot, and that includes the children under the age of 16 who aren't eligible to be vaccinated, at least 1 in 5 Delawareans, of course, with that one shot. As we mentioned, the president told all the governors, and there's a directive is going out tomorrow, that by May 1st, he wants all Americans, all residents of our state, to have access to a vaccination appointment. We're moving in that direction anyway because of the increased supply and our focus on fast and fair, fast meaning to move those vaccines into people's arms. So we're going to making some changes that we've been thinking about for a couple of weeks now to accelerate or collapse the phases. You'll remember we had 1A phase, which was our first frontline law enforcement and first responders, healthcare workers. Then we moved to 1B, which was senior citizens, 65 and older, those who are most vulnerable to COVID-19. And we're up to vaccinating 67%, we estimate, of that eligible population. And every Delawarean 65 and older who has been on our wait list have gotten an offer for an appointment at least once and many twice. And then we're moving to the 1B essential workers. We're going to put all those we're going to continue to work with those workers and their employers in setting up vaccination appointments and vaccinations on site. You remember we talked last week about starting up with poultry processing plant workers, which we did this past week. We've been working with other essential work groups to do vaccinations on site, as well as to make appointments with our mass vaccination sites. We had a big one over the weekend at Dover Downs, focusing mostly, primarily initially on teachers and educators, again, to meet the challenge that the president put out there to make sure all educators and teachers were vaccinated by the end of the month. We have made available appointments to all educators who want them. We will continue to vaccinate those who haven't taken access to an appointment, and we will meet our obligation to have them all vaccinated by the end of the month. They obviously can get those vaccines at their local pharmacies. We are ramping up the supply that we're giving the pharmacies. The federal government is doing the same, and they have a separate allotment they have to Walgreens pharmacies in our state and the federally qualified health centers. And so beginning tomorrow, the pharmacies will be giving vaccines to Delawareans 50 and older. So if you're 50 and older, you can go to your pharmacy and get registered. By the 23rd of this month, we will have a registration process for 50 and older. We are focusing right now with our healthcare providers and hospitals on meeting our responsibility to those Delawareans that have existing health conditions that make them more vulnerable to COVID-19 and with the severe or moderate healthcare conditions. And so our healthcare providers, our physicians, our hospitals systems are going to step up to help us with that obligation. We don't have the resources, frankly, or the ability to determine who has those conditions. Our healthcare providers do, and so they'll be focusing on those populations. And as I said, beginning on March 23rd, we will be moving, instead of our 1A, 1B, 1C approach, we will moving to an age-based allocation. 50 years and older can register at the State of Delaware for a COVID-19 vaccination. Those 50 and older, remember, are eligible at pharmacies starting tomorrow. And so we will give fidelity to our commitment to Delawareans who have pre-existing health conditions that put them at greater risk through our healthcare providers and through hospitals. And we are also working with essential employers, and you can get information through your essential employers. So you'd sign up with your essential employer, with your pharmacy, and ultimately after the 23rd on the Delaware registration list as well. We're working with people with disabilities, the agencies that serve those folks, to get those folks vaccinated as well. So on an ongoing basis, we will continue to vaccinate Delawareans who have not taken the opportunity to get vaccinated, or 65 and older, who are registered on our state waiting list. We will partner with employers, as I've said, to vaccinate frontline essential workers. And our focus will be, in all of this, fast and fair. We will have smaller community events, partnering with those community providers and other vaccinators to get to our vulnerable Black and brown communities across the state. So with that, as an intro, I'm going to turn it over to Dr. Rattay to build on some of the details with what I've just gone over. Dr. Rattay.
Thank you so much, Governor. So as always, let me start with our areas of concern slide. And you can see the state doesn't look so bad this week. We still do continue to have our 3 Newark zip codes, as well as Hockessin, Townsend, and Viola on the list, but all of these zip codes are showing lower case rates. And I want to give a special shout out to the University of Delaware for the way that they have approached the pretty significant outbreak that occurred quickly when students returned to school this past month. They have had total over 600 cases reported at this point in time, but the quick response that the University of Delaware made to the situation and all the mitigation strategies that they put in place really quickly drove down the case rates. So although they are doing a tremendous amount of testing, I want to give a shout out to Dr. Tim Dowling, who has really done a great job getting students tested. They only had 38 cases reported to us this last week. So really tremendous improvements on that front. And overall, as the governor mentioned, we are seeing some improvements in our case rates and our percent positivity. Well, thanks to AJ Shaw and his team, we still are doing a really good job getting people tested, which is so important. So on our vaccine tracker today, it shows that we have 331,734 doses administered in our state, which is great. A lot of progress has been made, and we're seeing an acceleration in administration of doses. And on the next slide, you can see that at this point now we have 124,000 people who've been fully vaccinated, and over 90,000 who've been partially vaccinated, 74,000 seniors who've been fully vaccinated, and 49,000 under 65 who've been fully vaccinated. If you haven't had a chance to check Vaccine Tracker recently, we now are posting the numbers of people who are fully vaccinated, which is helpful information. And on this slide, as the governor said, we're really excited that 67% of seniors, and we actually know that number is more. We're waiting for data to be placed into the system. So at least 67% of Delaware seniors have received at least one shot of vaccine so far. And for those 16 and up, it's 24%. So we're really excited to see progress being made in our states. And I will also mention, as we're focused on seniors, we have been working since January 20th on getting people on our wait list vaccinated. One thing that we are certainly seeing is a lot less individuals from the wait list now are signing up for a vaccine. Everybody now on that wait list has received opportunity to get vaccinated. And so that's a really important sign to us that we can start moving forward. So as the governor said, we really are very excited to accelerate our efforts at this point, given, as I just mentioned, decreased demand among seniors, increased supply, and increased capacity among our vaccinating providers. It is time for us to move into kind of our next the next steps for vaccination. And while we're moving away from calling this phases at this point, it really is important that we prioritize those who are at the highest risk over the next month and get those vaccinated before we fully open this up to the whole population. And so, as the governor said, we're asking our medical providers to identify those who are at the highest risk. And there is a list of conditions that would be in the highest risk. But if they, we want them to use their judgment. So there's also a list of moderate risk conditions. And there's also conditions that may not be on either list. So we can't make all these decisions, as the governor said, about really who should be prioritized. We know that there are certain conditions that are at highest risk. But for example, you might have an asthmatic who is with uncontrolled or difficult to control asthma, who would be at a higher risk than maybe somebody with well-controlled diabetes. And so again, we're asking medical providers, please prioritize your patient population based on risk and start reaching out to them. Additionally, we're also asking them to identify individuals who are caregivers of individuals who are at high or moderate risk individuals. So for example, someone who cares for a child with significant risk, the child would not be able to get vaccinated at this point, but the adult could. The adult being a non-paid caregiver now is eligible through their providers to get vaccinated. So we're really, really happy to open the door to really get more individuals at risk vaccinated. But of course, we want providers to continue to vaccinate those who are age 65 and plus. And I do want to make a comment. I did mention that medical providers will be reaching out to many of their patients to let them know that vaccination is possible. Providers are probably already today, given the news, already getting lots of calls. My guess is many of them are going to be quite overwhelmed. So we're just asking people to be patient. Many providers are vaccinating, some aren't vaccinating, but they have been given guidance to refer their higher risk patients to health systems and have received contact information there. Pharmacies, we're really excited, also are, as of tomorrow, going to be vaccinating any individual in the state who's 50 and older. Again, risk is strongly related to age, as well as those underlying chronic conditions. And since it's hard for pharmacies to fully diagnose somebody's health status, we are happy to have pharmacies now being able to vaccinate any individual in the state who's 50 and older. Again, vaccination spots may be very limited as the demand is going to be really high over the next coming weeks. So please be patient. But again, pharmacies are really beginning to expand their capacity. So we're grateful for that. And some of the pharmacies are also either working with us on employee vaccination events. So like Acme Albertsons has been great in helping vaccinate teachers and childcare providers. So we'll continue to do that work with pharmacies. Additionally, Walgreens will continue to vaccinate till the end of the month teachers and staff and childcare providers, all in the education field. And again, we want pharmacies as well to prioritize those who are 65 and older for vaccination. For us, for our state vaccination, we're gonna kind of stay behind a little bit for the next week. We really want to make sure that our seniors are getting a last shot before demand increases significantly to get vaccinated. And we also are going to continue to focus on those frontline employee groups we talked about last week, like poultry and food manufacturing and postal service and grocery store workers, higher education. So we're going to continue to focus now this week, next weekend, and next week if we need to on those groups. We also are absolutely going to continue to focus on our underserved communities and those that we know who aren't well served by large events. So our community health services and is partnering with many community organizations, and just this week has 19 small vaccinating events around the state. We also are doing more vaccination where we are doing targeted outreach and vaccinating individuals in our 3 state service centers. So we will continue that as well. And as the governor mentioned, we will be opening our state waiting list to any individual 50 and older on March 23rd. So the process that we've been going through over the last couple of months, where we'll identify those on the highest risk, who are the highest risk in that waiting list, will begin to receive invitations to our state-run events, and that includes the curative events and others as we move forward. So, again, as we look past the stages we're announcing today, and we are likely stepping away from these phases that we've previously discussed. Really, this is our way to accelerate our vaccination efforts and to get more shots into more arms more quickly as supply is increasing. But so what do we need people who are watching and or listening to remember as the bottom line here? For those who are 65 and older and have not gotten vaccinated yet, if you're on our waiting list, please take advantage of one of our invitations that you've received. If you are not on our waiting list, please do get on our waiting list, because we are going to send out more invitations over the next few days. So that's really a great way, an easy way to get yourself a vaccination spot within the next week or so. For those frontline and essential employers, so what we had been calling 1B and 1C employee groups, if you have not been working with us, please make sure that you send an email to vaccineplanning@delaware.gov so we have your information. You can take a survey so we have a better understanding of what your needs are, and we can get your employees connected with vaccine opportunities. For those who are in the high and moderate risk condition groups, again, check with your provider, but just be patient, knowing that they're probably getting tons of calls right now. And same with pharmacies. If you're 50 plus, either check with your pharmacy, try to get on a wait list with your pharmacy, and also get on our state waiting list next week. Let me shift gears a little bit. We have seen, and the White House was just mentioning today, that this was the busiest travel weekend this past weekend in over a year. So we know people are beginning to travel, and we just want to send a reminder to people that travel is not risk-free. There are absolutely risks for travel, and that depends on what people do and how they travel. If you are taking public transportation, mass transportation, including airplanes, you have to be extra careful. If you are going to events, gatherings, again, you have to be extra careful. So what are some things you should do to travel more safely? First, if you're in any of the eligible groups, please get vaccinated. Do your best to get fully vaccinated before you travel. That, of course, will make it safest for you and anyone around you. We strongly advise you to get tested. We advise you to get tested with either the PCR or the rapid antigen test 1 to 3 days before you travel, and then get tested 3 to 5 days after your trip. And while you are, when you come back after your trip, you do want to make sure that you're being very careful while you wait for your test results. So, that means making sure you're social distancing, wearing masks, washing hands frequently, etc. The mask is your most important tool when you travel. Keep your mask on, especially on public transportation. Make sure your mask fits snugly. Consider double masking, especially if you're on a bus or a plane. And avoid being around those who are at most risk, those who are older, those with more chronic conditions. And then avoid attending parties, events, or large gatherings, especially where you or others are not wearing masks. So if you go to a larger type of event, again, really important that you wear that mask that fits snugly around your mouth, or double mask. And if you are around people who aren't masked or you aren't, we are asking that you strongly consider quarantining yourself for 7 days after your trip if you get tested at 5 days, or 10 days after your trip if you don't get tested. And with that, I am going to hand it back to you, Governor. Thank you.
Thank you very much, Dr. Rattay. Really important information there. I'd like to go back, thank you, to the what to do slide, because I think this captures it really well. With respect to our vaccination efforts, we're in a transition period kind of over the next month and a half to respond to increased supply. So we're getting more vaccines on a weekly basis. We expect to get more Johnson & Johnson single-dose vaccines, which is a good thing. And then, of course, the President of the United States, President Biden, has put out there the directive to move to an all-in approach starting on May the 1st. So we're going to continue to focus on working our seniors 65 and older off of our waiting list. And so we'll be putting those out for the events that we are sponsoring. AJ is going to talk a little bit about that. We're really going to focus on the next two, the frontline and essential employers. We're working with employer groups. They've signed up. We're directing them, again, to vaccination appointments and to vaccination opportunities on site, depending on the employer. And we're really asking our medical providers, as Dr. Rattay said, to help us with identifying those with pre-existing severe health conditions, moderate health conditions that put them at greater risk. It was a commitment that we made back in the beginning. So those who are between 16 and 64 with those pre-existing conditions, to contact your medical provider. And then again, opening it up to an age-based system going forward, 50 years and older at pharmacies for this week, and then the 50 and older sign up starting on March 23rd. And we'll be using that age-based system as we move beyond May the 1st. So AJ, talk a little bit about testing and maybe some thoughts on our individual efforts to put vaccination shots in people's arms.
Thank you, sir, and good afternoon, everybody. Again, first start off with testing. Wouldn't be a meeting if I didn't do that. So I saw some leveling off really of testing last week, finished just under 36,000. So again, if you look at that over a monthly level, well over the 80,000 number we hit to, or was our goal to hit back in May. And, we'll definitely be in the 120, 130 range this month. Again, ample opportunity out there. We have the new flyers on the de.gov/get tested. We know people, may be having spring break or other events that are coming up. As Dr. Ortega just said, the risk is still out there. Please take advantage of these testing events. We absolutely have, the ability to expand the number of people that we get tested on a weekly basis. We're not slowing this down at all, as we know it's a very important component to beating the pandemic. So again, de.gov/get tested. Lastly, Dr. Ortega and the governor just gave a lot of information, a lot of new changes that are coming out about the vaccination eligibility. We know pharmacies 50 and older. We know our medical partners are going to get individuals that have pre-existing medical conditions, and the state's still going to be a backstop for a lot of these coordinated efforts. We continue to be committed to offering vaccination events for those over the age of 65. We have events every day in Dover, 2 days a week up in Wilmington, 2 days up in 2 days down in Georgetown. And everybody on the state waiting list has been offered an opportunity to get vaccinated at one of those. We know everybody can't jump out and get it right when they get that email, but we're committed to keeping these events going for the next few weeks as we expand eligibility with other partners. So Curative will continue to be 65 and older for next week. And then kind of as Dr. Ortega said, as we see the demand and those slots staying open, we'll then make sure we expand that to the 50 and older group when it makes sense to do that. We're also going to be back at the Speedway the next 2 weekends as well. Dr. Ortega's team was out there this last weekend, did about 15,000 individuals off of our, starting with educators and some of the other essential employees. We're going to be out there again this weekend, Friday, Saturday, and Sunday, by invite only, helping those essential employee groups, knowing that we have the mechanism to get it through a lot in a few days. So let's make sure we balance that, as well as continue to provide vaccine to employers that have enrolled with the state to get those. So we talked about the poultry plants, what we did a few weeks ago. We'll start working with some of our other education partners and the grocery stores, pharmacies, et cetera. So it's kind of a layered approach that we need, but the state's going to ensure we have events as well. So that'll be at workplaces, provider events, and then the Speedway. We're also looking past April as well, when we know we're going to have more vaccine in the state. Right now we're getting that 40,000-ish number a week that is for the state to administer or distribute to our partners. That number is going to have to increase. We know that we're going to be ready. We're going to look at probably nothing as large as we've done down at the Speedway, but we'll look at sites up in Newcastle County and down in Sussex County as well. There'll be a little bit more of a traveling road show to help as we go to the 50 and over and those essential workers over the next 6 to 8 weeks. So more to come on that. But again, really that's supply dependent. We know we want to provide the vaccine to the medical community, the pharmacies, as well as do some of these essential workers. So we can't put all our eggs in one basket. And then next weekend, the weekend of the 26th, will be our first weekend that we're pulling names off of the really list with 50 and older individuals. So exciting that a lot of people have their first opportunity to get vaccinated next weekend. Again, we'll see the actual numbers when we look at our allocation for next week. But the event down in Dover, from the time you pull in and park to get registered to the time you get the shot in your arm is between 15 and 20 minutes on average, and then you spend just as much time, if not longer, down the observation parking lot before you leave. So it is probably the most smoothest running event we've had, and it gets better every week. Kudos to Diane and her team and the National Guard men and women that we have out there, about 90 that will be out there this weekend assisting public health, as well as to our county partners. Newcastle County, Kent, and Sussex have all provided paramedics to assist as the vaccinators. And then we couldn't do it without the Medical Reserve Corps that our Lieutenant Governor and others tirelessly, pull in to assist us through this pandemic. So the state's still here. We have a lot of efforts coming up, as well as the community events, but we'll be here with this layered approach as vaccine supply will increase. Governor?
Yeah, thank you, AJ. Thanks for the great work of you and your team, all our partners there at the Speedway and other vaccination sites. We're really making tremendous progress. If you think about it, we're through most of the 1A populations, frontline healthcare workers, first responders, paramedics, law enforcement. We're 67% of our seniors 65 and older is our estimate. Continue to work through that. We have the waiting list there and working through, giving opportunities for folks to get vaccinated. Those are the most vulnerable populations. We're making real progress with frontline and essential employees of those businesses, and we'll continue to do so. We're building, we'll continue to build. Part of the message here, we'll continue to build on pharmacies. Walmart has been a good partner, and we expect that can grow with our medical providers and hospitals, particularly now in these weeks as we open it up to 16 to 64-year-olds with those pre-existing conditions, and then ultimately getting people at the pharmacies now 50 years and older, and then signing up starting on the 23rd to get in for state-run appointments and vaccinations. So we're going to ramp up with the supply. We've got to, and we're going to meet the objectives that President Biden has set for us and for other states. So with that, we have we've got media that has joined us, and we welcome them and their questions.
All right, first we'll go to Nick Ciolino from Delaware Public Media.
Good afternoon, everyone. Dr. Rattay mentioned earlier that 67% of seniors have already been vaccinated, and the opportunity had been extended to all seniors to get a vaccine. Now that we're opening it up to more populations, how does the state ensure that maybe some of those seniors who still have yet to do it but would like to are still at the front of the line?
Yeah, we're still going to prioritize those for appointments. When we have, and AJ can expand on this, when we have our sites like last week at Dover Downs, we had it was targeted for educators and teachers. We did almost 7,500, I think, vaccinations. When we have clinics like that at Dover Downs, we will provide opportunities for seniors to get those appointments. AJ?
So the only other thing I'll add, sir, is, so Care to the partner we've been working on now for almost a year with testing, we've utilized them in all 3 counties for vaccination events as well. So they will be getting, invites to that, until we expand that to the 50 and older. So we still have some space in those, as Dr. Tay was saying, the demand is still there. It's just, they don't fill up as quickly as they did a few weeks ago. But until further notice, the events we schedule for next week will still be 65 and older only to provide the access that you're talking to that population.
And we know that they're also going to their local pharmacies and getting vaccinated there because, when they don't respond to an appointment offering when we make it available to them because they've already had their vaccination.
And one other question, I feel like a version of this question gets asked every week, but with the vaccine effort expanding and more people in the state getting vaccinated, is the state developing more sense as to when it might be appropriate to start easing restrictions?
Yeah, we're looking at that. We will be easing restrictions. We're looking at that right now. We have, as I mentioned in my remarks, regular phone conversations, conference calls with business groups, with the hospitals, with the mayors across the state. And we've been working with public health. Jamie Mack and his team have been engaging with those business establishments as well. We've had a call with the Restaurant Association and their members, and just working on loosening those restrictions, keeping in mind what's happening in states around us.
Thank you.
Next, we'll go to Amy Cherry with WDEL.
Hi, everyone. Thanks so much. I believe it was last week that you answered a question saying conditions in the state were pretty good for long-term care centers and assisted living facilities to resume visitations. But we're getting a lot of reports that some still aren't allowing visitation and that many residents remain locked down in a sense. Is there any plan for new guidance or any kind of mandate that would open up these facilities again for visitation?
Dr. Rattay, do you have anything on that?
I know that the Division of Healthcare Quality is looking very closely at adjusting visitation recommendations at this point. I also know that the federal CMS, the federal agency that oversees Medicare and Medicaid, has also come out with new guidance. So there's definitely a lot of interest in increasing visitation in a safe way. We know that for residents in these facilities to not have had the opportunity to spend time with their families has had a tremendous impact on them. And so both our department and healthcare quality, the Division of Healthcare Quality, as well as CMS are all really strongly pushing towards a relaxation of those visitation restrictions.
Thank you.
All right, next we'll go to Cassie Semin with WBOC.
Hi, everyone. Dr. Rattay, this might be a good question for you. With these new guidelines for who can be available for a vaccine, and that list that comes with it of those different types of ailments that people may have that might qualify them for the vaccine, how do we know specifically, whether these people will have these ailments? Do they need to bring proof of that to get the vaccine to make sure, that this isn't something that's being abused? I know we've seen in other states, people try and take advantage of some of the different areas where they can get a vaccine ahead of the time.
Yeah, Cassie, that's a really great question. And that is, one of the reasons we're taking the approach that we are as a state, where we're really looking to our healthcare providers in the states, our hospitals in the state who have medical records on individuals to really identify who is at highest risk based on this list of conditions. And so that really takes some of the decision making out of the hands of pharmacies to say yes or no, should somebody get vaccinated at this point in time. And so, we think that that is really the best approach to put those decisions in the hands of the providers. And our provider community is very enthusiastic and excited about this approach that we are taking, as are our pharmacies. Now, for our state system, the wait list that we will be going live with on March 23rd, we are asking people to select conditions that they have. But when we stratify, when we look at risk, certainly age is an important factor as well. And so, we put all of that in the mix to determine, how we extend invitations. But the reality is, over the coming month, so many Delawareans are going to be able to get vaccinated. And so we're hoping that Delawareans, don't kind of have this approach of where, well, I'm at a higher risk than this person, or, we need to let the providers decide, and everyone to recognize that, those individuals who are at risk by age or chronic condition are all going to have an opportunity in the next month to get vaccinated.
And also, I noticed that there has been, when we discussed this, expansion of who is allowed to get a vaccine, we're not necessarily using the phase 1C title for it yet. Is that because we're still focusing on the 65 and older, as well as these people with these different types of ailments? And also, when could we see an expansion into that official 1C capacity as we're getting closer to that May 1st deadline where everyone can sign up?
So that's really the fundamental point. We're moving away from the phase approach while providing, fulfilling our commitment, particularly to those who are under 65 with pre-existing conditions. So that's going to be the focus, as you and Dr. Rattay just discussed, with respect to directing those 16 to 64 to the medical provider to make sure that they who are most at risk get that vaccination. Then we're going to move towards a system really just we are working, secondly, on employers or in those frontline essential employer groups with their employees to make sure they get vaccinated. At the same time, we're expanding to 50 years old and up, and then beyond that, first 50 and up at pharmacies, and then the registration system that starts on the 23rd, because we really have to get out of the 1A, 1B, 1C perspective and just accelerate putting vaccines in people's arms across the board while meeting our obligation to those with pre-existing conditions, those Delawareans with special challenges and physical disabilities.
Thank you.
And next we'll go to Brandon Holbeck with the News Journal.
Good afternoon. My question sort of goes along with some of the questions that were just asked. With the group of people that are with high risk or moderate risk medical conditions, how will the state ensure that that system doesn't exacerbate some of the disparities we're seeing in race data and ethnicity data with the state, given that it seems reliant on a connection or a pre-existing relationship with a primary care provider, who would have your records and things like that, and maybe a lot of people in the underserved groups wouldn't have that?
Yeah, so that's a really great question, and one that is the top of my mind all the time. I would note that we are making progress. If you look on the vaccine tracker, we're into double digits with those who are identify as Black that have been vaccinated, and making progress in improving the numbers there. With those identifying Hispanic, we still have a considerable number on that tracker, Brandon, as you probably noticed, that without information, and we're working with the pharmacies to get that race and ethnicity data. We expect that we'll get diversity from some of these frontline groups. If you think about the demographics of the workers in our poultry plants, we expect to get some greater diversity there. We have our community outreach. We do have commitments from our partners, our hospital partners, once they focus on those with pre-existing conditions, to continue to do those community-based events. And so our dual objectives of fast and fair remain in effect. We are seeing better demographics coming back from our pharmacies. I think we're getting really good numbers from Walmart, and we'll pay attention to that. But it continues to be those dual objectives, and I in particular am focused on that as we look at these changes that might create, as you say, a less diverse vaccination effort.
If I can add on to that, when we look at the conditions that are on the list for high risk and moderate risk, we know that there's significant disparities. So we know that for many of those conditions that we do see higher incidence of those conditions among Black and Brown communities in our state. And so Two things to add is when a recent survey suggested that members of Black and Brown communities most wanted to get their vaccine from their healthcare provider. And additionally, all 3 of our federally qualified health centers in the state now are going to be receiving vaccine from the federal pharmacy program. And so increasing opportunities across the state for all individuals are important, and we're going to continue to really focus on our highest risk demographic groups as well.
One of the biggest, Brandon, one of the biggest challenges there, and you've probably heard me say this before, in those communities is getting them on our registration lists, and obviously expanding the registration list as we are starting on March 23rd to those 50 years and older. We have that concern. We do have teams of people that have been making outgoing calls from various lists to try to get folks to register. It's much easier to run a vaccination clinic when you have pre-registration and appointments that are made off of lists like that.
My second question is with the essential worker groups that were in the old phase 1C, how will they be approached? Will they be approached similar to the essential worker groups in 1B that you're working on now, or folded into future parts of the plan? What's the approach with those occupations listed under the old 1C?
Yeah, so Jamie Mack and Public Health, the team, they have a registration process. And I think that I've heard something like 160 employers have signed up with that group. And so that'll be the process, and we'll continue to do that kind of outreach for those employers to get signed up. Some will be larger employers that where we might do a pod in conjunction with that industry, and we've had those requests across industries. On the call with the mayors this morning, they were inquiring about getting a pod for municipal public works workers, in the 3 counties, and we have those kinds of requests. And then we will also be getting them to put together lists to feed the larger clinics that AJ is running at the Speedway and other places, hopefully a Curative and some of the other larger sites that we have. AJ, you want to add anything to that?
No, you covered it all. It's a lot of employers will reach out to Dr. Arte's team, and Jamie have it kind of prioritized by risk. So we're going to get there, and it's going to be, how quickly could they respond, and then how deep can we get in the list too. So as the governor said now for a few weeks, it's got to be fast and fair. So we're not going to keep somebody that might fall in that 1B category from moving on to 1C if they can't make it. If we wind up walking into 1C a little bit to get vaccinations done, that's what we're going to do to be as most efficient as possible.
And if I may, it does take some creativity at times. I give just again an anecdotal answer to the poultry industry and those plants. We're finding a little bit of resistance for people getting vaccinated by their employer in the plant as we originally proposed. And so we're trying now, much like what we did testing, where we did testing in the communities with trusted partners, might be the local church. La Red is specifically the federally qualified health center, is getting vaccine allocation directly from the federal government to do workers in that community. And so depending on the employer, we might have to do things differently to reach their members, their employees.
All right, last we'll go to Tim Mastro from Delaware State News.
Hi, everyone. Just another question on the waiting list. Is the state or DPH, do they know the percentage or just how many of the original 53,000 that signed up on the first day who have received a shot? And as we start to add more members of the population to the waiting list, at any point will the longer you've been on the list start to give you priority or a better chance of being called?
Yes, I'm sure Dr. Rattay can respond to part of that, but I did hear this morning, and we talked often about how many people have been provided opportunities. How many people have we worked off the waiting list? I think the waiting list got close to 150,000, I think 133,000 or thereabouts. And we've worked a big number off of that list. What we don't know, unfortunately, is a kind of an airtight way of knowing who was on that list got vaccinated at a Walgreens or some other place, just because there might be a small difference in their name on our waiting list versus the name, maybe they use their nickname for at Walgreens, et cetera. And so we don't have, I don't think, a specific number there, but we have worked a considerable number of folks off of that 65 and older waiting list. Dr. Rattay, and by the way, it's the easiest list to make an appointment for one of the big vaccination pods that we have, because we have all that data and we can send out an appointment invitation in an email. Dr. Rattay?
Yeah, I mean, just a couple things I will add is, so it's a total of 136 Delawareans 65 plus who signed up for the waiting list. We know that over 86,000 received their vaccine. As the governor said, there's a matching issue where we know that there's a number of those individuals that we don't show them in our system as having vaccine. When we call them, they say that they've been vaccinated. So we are trying to essentially manually clean that up so that we know who's been vaccinated and who hasn't. But every single individual on that waiting list who we know hasn't been vaccinated has received 2 invitations in the last week to receive vaccine, and they will receive another one. And so again, we're not seeing a lot of individuals on that wait list signing up. It really has slowed down a lot, and that's a good indication to us that individuals on the wait list have mostly taken advantage of vaccination. But again, we do really want to emphasize this is your last best chance. If you are on the wait list, please take advantage of one of our invitations now while it's easier for you and you're getting a direct invitation. And if you're not on our wait list, please get on our wait list immediately, vaccine request at delaware.gov, so that you can get an immediate invite for a vaccine opportunity.
And it was one of the reasons we started looking for other ways to get people to these vaccination appointments, recognizing that our supply was increasing. We just weren't getting the response from our wait list that we had, say 3 weeks or 4 weeks ago, where there was so much greater demand. And so in order to get the supply out that was increasing, we needed to make more people eligible and get more people on our list.
All right. And I believe AJ mentioned this a week or 2 ago, so you might just need to reiterate this, but I did see there are some links floating around on social media to sign up for vaccinations at Curative site. Could you just speak to, is the only way to sign up for a Curative site if you actually get an email?
So no, Tim, I think that's a good question, and something we have stressed a lot. We are sending a URL to individuals that have registered in the state and they have been over the age of 65. That link got to some people, especially last week, under the age of 65. They registered, and then when they got to the site, they were denied their shot just because we were holding that rule of 65 and older. So, we're asking people to, work with us, follow the process, register online. We'll send you the link and you can register that way. I think we all know there's a lot of emotion that everybody wants to get vaccinated yesterday, but we're still going to follow the direction from Dr. Tay and her team about who gets vaccinated and when.
Another reason to open up the process or to go through this transition that we are going through, moving away from the phases, not, obviously meeting our commitment to those most vulnerable, 65 and older, and now moving into 16 to 64-year-olds with pre-existing health conditions, but then opening it up so we can get the kind of demand to meet the supply of the vaccine that we're going to continue to receive at this point and going forward.
We're going to go back to Amy Cherry, who has her second question.
Okay.
Thanks so much for coming back around. Something that someone asked kind of sparked another question within me. And I'm wondering if the onus, it really kind of appears to be on employers in this essential employee vaccination process. The onus is on the employer, but what if the employer sort of isn't willing to take that on and they haven't filed for a plan with the state? I'm wondering if you envision a pod or an opportunity at pharmacies where they could show a work ID or something of that variety to get vaccinated.
Yeah, so I don't know that we've talked about that yet, but obviously we worry about smaller businesses that don't have the internal capacity to manage something like this, and we've talked about having pods to do that. Obviously, the waiting list that starts with 50 and older and then moves younger and younger will be an opportunity for those folks as well. Again, gradually moving away from the employer-based approach to an age-based approach. And again, supply is driving that as much as anything, as well as the directive that we're going to receive tomorrow from the federal government about May 1st and opening it up to everyone. AJ, anything you want to add to that?
Just that, we've anticipated that, Amy, and I think we have reached out to, it might not always be an employer, but Jamie's reached out to organizations and communities to grab those individuals that would be in those essential positions. So it's a balance, right? We want to make sure we follow the process. We want to make sure we're fair, but we don't want to let anybody feel like they don't have that opportunity. So right now we haven't had those discussions with the pharmacies. We do know after having multiple meetings with all the pharmacies across the state, all their leadership, the age is the easiest thing to let them get people in the door, and we want to make sure we don't slow it down. So that's why we're doing one thing with the medical community, another thing with the pharmacies, and then these other public events are a little bit more of the batch stop, as I've used before, for essential employees 65 and older that haven't been able to get in somewhere. And we'll expand that as we get closer. And then, hey, when May gets here, it'll be easy. No more policing who signs up. We'll just have to get people in the door.
And AJ makes a really good point. The pharmacies, the Walgreens pharmacies have been given direct allocations and specific directives to prioritize educators, school personnel between whenever that was, a week or so ago, and the end of the month, and they're getting a separate allocation based on their location, and so they have told us that the best way for them is just to have an age cutoff. And so we think they can be a better part of our foundation here with just the limitation that they can easily verify with the driver's license or something that indicates a person's age.
If I can add just one more thing to Amy's question, even small employers, even if you've just got a couple, that you want that fit in the group, please email vaccineplanning@delaware.gov, because we are getting invitation opportunities out to any size business that has essential employees. So that still right now is the best and most organized approach that we have.
All right, this is the last question for today. It's pre-submitted from Susan Canfora from Coastal Point. She asks, is there a timeline for when younger Delaware residents will be able to get vaccinated?
As soon as possible. I don't, first of all, I don't know what she means by younger Delawareans. We're going to move from 50 and over quickly to open it up beyond that by May the 1st, and so include everybody over 16. So the vaccine has not been approved for anyone under 16 yet, right, Dr. Rattay? She's shaking her head yes. So we'll move as quickly as we can after we hit 50 and over and below by May the 1st, the directive will be that it's open to everybody, as I understand the president's challenge to all of us, and we expect to be there by that point, or we hope to be there by that point. So that being the last question, I would like to just thank everybody for joining us again today. Thank Dr. Rattay and AJ for their great work and their teams as we've been, moving from one approach to another, being buffeted a little bit back and forth by our federal partners. So we are focused on fast and fair with respect to vaccinations. We're making real progress, particularly with those 65 and older. 67% of those who've signed up have been vaccinated, and we've given at least everybody on our waiting list at least 2 opportunities for appointments. We'll continue to focus on that, the most vulnerable population. We'll continue to work. And so if you are 65 and older, make sure that you avail yourself of those opportunities. We've got this slide up again, what to do. Go to vaccinerequest.delaware.gov for those invites. We're going to continue to work with frontline and essential employers and their employees to plug them in to vaccination sites like Dover Downs, and to get them signed up for other opportunities. We've really asked our medical providers, our physicians and hospitals and other medical providers to help and really focus on those 16 to 64-year-olds with those severe and moderate health conditions that put them at greater risk, and their caretakers who may not have the conditions. We're working on people with disabilities and those organizations to get vaccines into the arms of those Delawareans. And then pharmacies will start tomorrow vaccinating people 50 years and up. And on March the 23rd, we'll start with our 50 and up vaccination registration list. Our goal will continue to be fast and fair. We're making progress. With your help, we'll continue to do so. Thanks for joining us today. We look forward to seeing you next time.